American psychologist and professor of psychiatry Kay Redfield Jamison is one of the world's foremost authorities on bipolar disorder. She's spent her career researching, lecturing, and writing seminal books on the condition, a condition that she also happens to have had her entire adult life. In her memoir, An Unquiet Mind, Jamison details what it really means to be bipolar. She writes of not sleeping for days on end, of feeling long periods of euphoria, and filling whole notebooks with her racing thoughts and grandiose ideas. While in these manic states, she experienced a tremendously inflated sense of self-esteem and did impulsive things that felt good at the time but had painful consequences, like going on lavish shopping sprees, engaging in promiscuous behavior, racking up credit card debt, and emptying her bank accounts. These episodes were followed by emotional crashes, crippling bouts of depression that sent her into a suicidal spiral. At the age of 28, Jamison tried to kill herself by taking an overdose of lithium, lapsed into a coma, but thankfully emerged from it determined to find help through medication and therapy. Through her research and writing, Dr. Jamison has pioneered our understanding of bipolar disorder, depression, and the nexus of mental struggles that we now think of as mood disorders. And she's probably one of the best ambassadors we have for all those people who live successful, productive lives with mental illness. Just like the anxiety disorders we talked about last time, mood disorders are misunderstood. They're diluted by depictions of depression as something that can be treated with one day at a spa, or descriptions of people as manic depressive just because they were sad yesterday and aren't today. As students of psychology, our job is to understand what mood disorders really are, how they manifest themselves, and what might cause them. And as you probably guessed, this can be pretty tough terrain to explore. These disorders can take people from terrifying highs to pits of despair that seem all but bottomless. But in between, there's what Jamison has called a rich, imaginative life, all made possible by your moods. We've been talking a lot about terms and concepts that mean something different than what you think they mean, but this time, the term mood is not one of those. In a psychological context, moods are pretty much exactly what you think they are. Emotional states that are even more subjective and harder to define than the emotions themselves. And while psychologists have defined about 10 basic emotions, moods tend to fall into two broadly and infinitely variable categories. You got the good moods and the bad moods. Probably the most important distinction between emotion and mood is that moods are long-term emotional states rather than discrete, fleeting feelings. And mood disorders, which are characterized by emotional extremes and challenges in regulating mood, tend to be longer-term disturbances. These include depressive disorders typified by prolonged hopelessness and lethargy, and bipolar disorders, the most prominent of which involve alternating between depression and mania. Depression's been called the common cold of psychological disorders, which is not to say that it isn't serious, but it's common and it's pervasive, and it's the top reason people seek out mental health help. We've all felt down before, obviously often in response to a specific loss, a breakup or a lost job or the death of a loved one. And the fact is, you probably should feel bad at times like those. It can actually be good for a mind and body to slow down to help digest losses that you experience, but in general, sadness is temporary. It's when sadness and grief extend beyond the generally accepted social norms or plunge into a depth that causes serious dysfunction that you find yourself in the territory of depressive disorders. The DSM-5, our handy if super flawed user's guide to psychological disorders, officially diagnoses a major depressive disorder when a patient has experienced at least 5 signs of depression for more than 2 weeks. These symptoms include not just depressed mood, but also significant weight or appetite loss or gain, too much or too little sleep, decreased interest in activities, feeling worthless, fatigued, or lethargic, difficulty concentrating or making decisions, and recurrent thoughts of death or suicide. So while everyone experiences sadness, depression is a physiological as well as psychological illness. It messes with your sleep and appetite and energy and neurotransmitter levels, all interfering with the way your body runs itself. Plus, in keeping with our definition of psychological disorders to be considered a true disorder, this behavior needs to cause the person or others around them prolonged distress, the feeling that something is really wrong. Just as a person with severe generalized anxiety disorder may never want to leave the house, a clinically depressed person often feels so hopeless and overwhelmed that they have trouble living a normal life. And unlike the bipolar disorders, the depressive disorders tend to be all lows. You've probably heard of manic depression. It's the outdated term for bipolar disorders. These include those classically dark lows of depression, but also bouts of the opposite, of extreme mania in more severe cases. Someone suffering from a bipolar disorder may flip back and forth between normal and depressive and manic manic phases within a single day or week or month. And a true manic episode doesn't just mean being energetic or happy. It's a period of intense, restless, but often optimistic hyperactivity in which your estimation of yourself and your abilities and your ideas can often get skewed, like really, really skewed. Some patients experience mania only rarely, but when they do, it can be destructive. Kay Jamison has testified to that. Once during a manic episode, she bought up a drugstore's entire supply of snakebite kits, convinced of an imminent attack of rattlesnakes that only she knew was coming. In another, she purchased 20 books by the Penguin Publishing House because, she said, it could be nice if the penguins could form a colony. In other words, bad judgment is common. And it can get worse. Full-blown manic episodes often end up in psychiatric hospitalization since the risk to self or others can become severe. When the highs eventually end, they're often followed by dark periods of depression. When left untreated, suicide or suicide attempts are common, another element of the disorder that Jamison herself can attest to. Like so many things in psychology, the cause of mood disorders is often a combination of biological, genetic, psychological, and environmental factors.